Doctors and nurses, what self-diagnosis of a patient surprisingly turned out to be right. Story 1. My sister had a lump behind her ear that was causing her pain and was growing. My mom used to be a nurse, and she thought that it didn't look right. It wasn't just a cyst, so she kept monitoring it and started to become worried that it might be cancerous. For a whole year, my mom went back and forth with doctors, asking them to take her seriously, and one doctor finally agreed to go in and biopsy it. Lo and behold, my sister had stage 1 cancer, and it was a rare form at that. Story 2. Not quite the same, but my grandma had a series of what appeared to be strokes the last year or so that she was alive. We're not certain what they actually were, but it made for a very stressful time each time she would have one, waiting to see if she would recover. Then she would go back home, be fine a while, and it would happen again. She was 97 at this point. My grandpa was 98. They had been married for something like 77 years. One night while she had been home, it happened again, and she had a pretty bad fall. As a result, something she was always afraid of. My aunt was sitting with my grandpa as my grandma was being wheeled out of the house, as he wasn't entirely all there mentally. Mostly fine, but definitely couldn't be alone. My aunt says he turned to her and forlornly said, quote, "I'm really going to miss her." My grandma didn't come back home from that one. Story 3, not the doctor, but I went in because I had shingles. Told them up front I thought it was shingles. The doctor kind of chuckles and says, "Well, you're far too young to have shingles. It's impossible." So I lifted my shirt and showed her my side where it was, and I instantly saw her eyes widen as she goes, "Oh my, that is definitely shingles." The doctors and nurses were a little sheepish and apologetic, but they did a great job helping me get better. I was the youngest case they'd ever seen, early 20s at the time. Story 4. My mom went to the doctor to complain about pain in her lower back by her kidney. The doctor did a quick checkup and told her it was nothing and that she was probably just sleeping wrong. My mom mentioned cancer, and the doctor said that it wasn't very likely because people with kidney cancer don't usually feel anything. She was adamant that something was wrong, so she went to another doctor that told her the same thing, but said he would run some tests to show her that it wasn't cancer. When the results came back from the test, it turned out she did in fact have cancer on one of her kidneys. And because she caught it at such an early stage, they were able to remove it before it spread. Story 5, not a doc or a nurse, but back in the early 80s, my mom, 30 at the time, could not convince several docs that she had breast cancer. It was different to just a lump or pain. They all responded with, "You're too young." Finally got one doc to write a referral to a specialist so she would shut up about it. She had breast cancer, was told she may need a mastectomy, but after going in, they were able to remove enough without having to go that far. She went back to the original doc and had a go at him and said if she ever heard his name come up for malpractice in the future, she would make a statement against him. She was in medical industry. Told him to never tell a woman she was too young for breast cancer. Edit. I call my mom for more details. It was in the right breast. There was no lump, just a dull and fairly constant pain, but not an intense pain. The mass was removed. However, years later, she had the same pain and had another mass removed. Years later again, and had small lumps rice grain size show up on mammogram and removed. No pain with these. This seems to reoccur on average every 10 years. She also told the doctor he was a danger to women and should retire. Yes, we have good health care, live in Australia. Both of us get annual mammograms. I'm not between ages 50 to 75, nor related to a doctor, so it isn't fully subsidized. I go to a private hospital that does the ultrasound as well. My breasts don't mammogram very well. Bill about $500, but based on family history, I will keep going. Story 6, when I was like 10 or 11, I woke up and felt sick. I told my mom I wasn't feeling well, but she said to just go to school and try to get through the day. Throwing up is normally one and done, right? Nope. Went to school and threw up twice on my way to class. Went to the bathrooms. Threw up again during class. Again went to the bathroom. Was told to go to the nurse because I didn't even look well. So I went to the nurse, threw up 2 more times on my way to the nurse, and about 15 times from the time my mom came to get me. She dropped me off at home at around 10 a.m. By 5 p.m., when she got home from work, I'd thrown up about 20 more times. At this point, I have no fluids in me, not even a cracker, and it was just dry heaving for hours. She took me to the hospital, and I was told I had an ovarian cyst that had ruptured. Scariest moment of my prepubescent life. Another time I'd overdosed wanting to self-unalive. Mom came home, called 911. Paramedics got there and thought I was effed up and high off weed. My cousin in the next room over hotboxed his room all day, every day. It wasn't me. I was dying, literally. They treated me how they would any addict yelling at me, etc. So yeah, they almost effed up. I was comatose for a while and was just violently throwing up everything in my system. Story 7, I had a spontaneous pneumothorax collapsed lung that came out of nowhere when I was 17. Had to go to the hospital and get a tube hooked up to my thoracic cavity to reinflate my lung. A week later, I was in statistics class and I felt my other lung collapse. I immediately knew what it was. Kind of a weird but very distinct feeling of pain and shortness of breath. Cut to me in the school nurse's office trying to explain that I had a spontaneous pneumothorax and I need to go to the hospital. Yeah, she didn't believe me at first. Story 8, I was the patient in this case, but back in February, I had all the symptoms of pneumonia, and the doctor kept trying to tell me I had the flu until the test came back negative for the flu, and the x-ray of my lungs showed I did in fact have pneumonia. I'm starting to think she was actually testing me for COVID, though. Story 9, patient here got into a car wreck and right arm started going numb a few weeks later. Self-diagnosed as disc pressing on spinal cord. Requested they do an MRI. Doc said to take more painkillers and it would go away. I don't like drugs, so I insisted. Footed bill for MRI that insurance wouldn't cover because I requested it against doctor's wishes. Bulging disc on C5-6. 7 months of PT and other non-painkiller drugs, arm works again. F insurance, F doctors that push painkillers. Nearly done with the debt hole that entire debacle put me into. Story 10. Not a doc or nurse, but a patient. I was having a kidney stone, and my BF at the time took me to the ER. The nurse kept asking what I did to myself because I was practically screaming in pain. Through tears, I managed to get out, "It's a kidney stone." I then sat in the waiting room practically passing out until my BF somewhat yelled at the ER staff. They came over to get me, and I couldn't even walk. The nurse said, "Well, you're coming back." My BF said to get her a effing wheelchair, 6 hours and a round of morphine. Later, I passed the stone. The nurse said, "Oh, look at that. It was a kidney stone." Like, seriously, what the F? I had 2 kidney stones at a relatively young age myself that I had to pass, so this story really hits home because, same thing. Doctors were very dismissive. "You're too young for that. You shouldn't be dealing with that." Well, guess what it turned out to be? So it's like, again, listen to your patients. They may not be medical experts, but their descriptions of how they're feeling should be able to help you as a doctor or medical professional connect the dots. Story 11. My mom was the diagnosee here. She had a coworker come to work with an active shingles rash a few years back. Mom was never vaccinated for chickenpox, nor did she ever catch it in her youth. A few weeks after this coworker decides to show up with live shingles. My mom starts developing this awful rash with, lots of little sores. Perhaps one may even call them pox. Who would have guessed, along with fever, body aches, the whole kit and caboodle. Mom went to the doc and said, "I have chickenpox." And the doctor took one look at her rash and said, "You're too old to have chickenpox. It must be some other thing. I'm sending you to the ER." One very expensive ER visit and nearly ruined Thanksgiving dinner later, lo and behold, she had chickenpox. We no longer see this doctor. Story 12. This is a little out there. There's a psychological condition that I can't remember the name of, where a person believes they're dead inside. Not a zombie, not deceased, but more soulless. Many have a flat effect rarely roused by stimuli and have no fear of death. Not looking for death, just entirely unconcerned by it. This guy was told to go to his doctor by his mother due to him mentioning numerous symptoms. Turns out he had a severely massive end-stage colon cancer that had spread everywhere. In the OR, sometimes you do a case knowing you're mostly checking to see if it's a lost cause, or not, known as peak and shrieks, hope, and nope, or under the hood ain't no good. There's other names too, I'm sure. Anyways, we looked inside this guy and he was such a case, a total lost cause. The irony being that he really was dead inside to a degree. Also that had he been more concerned with his health, he may have been more proactive in his care. So it ended up being a self-fulfilling prophecy. Story 13. Not a nurse, but my mother worked at a children's hospital in X-ray. Her second-born, not me, was vomiting and having symptoms as soon as he was born. She believed it was pyloric stenosis, a fairly rare case where the sphincter in the stomach closes up, preventing eating. The first doctor dismissed my mother, thinking she was being normal, mother paranoid. My annoyed mother brought her to a second doctor. The second doctor called in his med students and said, quote, "This is a baby with very, very early onset pyloric stenosis. You will not see it often this early." The mother just recognized it. Story 14, not a doctor, but the patient. As a first-time mom, I got super ill with body aches, constant vomiting, fever, diarrhea, sore throat, the whole works. I was super dehydrated and begged my husband to take me to urgent care. But of course it was a Sunday, so I ended up in the ER. I thought I had strep and or the flu because I was familiar with how that felt, and this was similar. They tested for both, and it all came back negative. Super odd. They gave me fluids and sent me on my way. 2 days later, my 1-year-old daughter got spots on the palms of her hands and soles of her feet. We took her to the doctor, and turns out she has hand, foot, and mouth disease. If you're familiar with HFM, you know there's nothing you can do to treat it, and by the time the spots arrive, the illness stage is usually over, and you feel better besides the fact that you have itchy hands and feet. So while I was there, I told her doctor that 2 days before I admitted myself to the ER because I was so sick, yada yada. And does she think I could also have HFM? She said it's a children's disease, and I don't have it. Well, 2 days pass, and now I have spots on my hands and feet. I had HFM in the ER, and pediatrician didn't catch it. Not that there was anything they could do, but it would have been nice to know. Edit to add, I never even knew my daughter was sick before the spots appeared. She acted totally fine, but it put my butt in the ER. And yes, her pediatrician dismissed the idea of me having HFM so fast. Good to know other adults had it bad too, and that it hits adults harder than children. Story 15. My wife visited a gastroenterologist at a renowned multi-specialty clinic, complaining of severe pain in her upper abdomen. Not all the time, but mostly after meals. The doc poo-pooed her concerns, saying it's only indigestion, and advised more water, analgesics, etc. She insisted on getting a USG scan done. The doc almost sneered, saying you must have checked the symptoms on Google. But just to put your mind at ease, let's get it done. While we were waiting outside the radiology room, the doc came by with the same all-knowing smile on his face. "So it's all fine, isn't it?" The lab guy came out just then, saying, "Ma'am, you've got lots of stones in your gallbladder. You must see a doctor immediately and get it operated." The doc hastily beat a retreat, and we've never gone back to him again. Story 16. Not a doctor, but when I was in early grade school, I had an accident on a trampoline and thought that I broke my knee. We rushed to urgent care, and they said that I was just bruised. The following week, still in PE and running, I'm doing sports, my knee still hurt, and we went to the doctor again. Not urgent care. And I fractured my femur right above my knee and had to be on crutches for 2 months. Also, the second time I got a concussion, I was rushed to urgent care, and they said it was a migraine. I knew I had a concussion, and so did my family. I ended up taking 1.5 months out of school and did part-time for another month. I don't trust urgent care. Story 17. After drug abuse, I was left with permanent lasting visuals. It's called HPPD, hallucinogen persisting perception disorder. Basically, anxiety up the ass. 8+ different visual disturbances that are continuously happening no matter time of day, open or closed, eye light or dark. Went into a treatment program after some issues with Xanax. Used it because it took away my visuals. I told them I have HPPD and that I see things that aren't there. They said, "That's not true. You're just trying to get a Xanax prescription." Fast forward 3 months and I'm out, still being told I'm making everything up. They convinced my family I was lying. Went back to my OG therapist that I've seen for 2 years, and she's been with me the whole time through my struggle with HPPD. After a year, she said she was comfortable diagnosing me with HPPD. Doesn't change the fact I still see crap 24/7, but hey, at least I was right. Story 18. Not a doctor, but the patient. Back in late 2016, I was 13. I started experiencing things like fatigue, joint and muscle pain, intolerance to exercise, migraines, depression, etc. I consulted Dr. Google with my friend, and the first thing that came up was chronic fatigue syndrome. I never really brought it up and got told I was just depressed, LOL. Well, lo and behold, 4 years later, now 17, after seeing approximately 10 different specialists, I get officially diagnosed with chronic fatigue syndrome. Sometimes it makes me wonder what my life would be if I got diagnosed 4 years ago. Story 19. Not a doctor, but I started having severe excruciating headaches come on while standing or coughing, laughing, etc. They became so severe they'd make me scream and vomit, but would disappear as long as I was bent over and hanging my head, or if I took crazy amounts of caffeine. Because the headaches were positional, I thought it was a CSF leak and that I needed a blood patch. One morning, my husband drove me to the ER, which triggered a headache, so I walked into the ER bent with my head hanging and saying I had a CSF leak and needed a blood patch. They did an MRI and it turns out leaks from Chiari. So I was right about the leaks, but wrong about the treatment, and I got brain surgery instead. Story 20. My dad is a neurosurgeon, and my mom thought I was having absence seizures. I basically zone out and forget what happened from the past 10 minutes or so, and my dad said I was just ignoring my mom. My mom took me to go get an EEG, and turns out I have seizures. Pretty strong ones. EEGs can take up to 2 or 3 hours long, and mine was 15 minutes. We walked to my dad's hospital, and my mom walked in, flaunting the paper, saying, "I knew it, I'm smarter than the neurosurgeon, ha edit." I just remembered something when I had my seizures. I was on meds and now I'm off. We're waiting to see if they'll come back. I've had to have someone check on me every few minutes to make sure I hadn't drowned. I couldn't drive, still can't, or swim, so hardly do anything by myself. Makes you appreciate alone time, lol. Story 21 obligatory. Not a doctor had a lumbar puncture done 2 years ago that got me a CSF leak. I had that leak for 8 months. The doctor that was responsible told me that, quote, "It's impossible. Your leak must have sealed." I took matters into my own hands and wrote a letter to the neuro department at my local hospital, basically laying down my thoughts and telling them I strongly believed I still had a leak after 8 months. They took me in and treated it. It doesn't end quite there, though. After the treatment, I developed what is thought to be RIH, rebound high pressure. This is a newly researched phenomenon found in patients that are treated for a CSF leak and that have had the leak for a long time. Basically, your symptoms switch from low pressure to high pressure. I had to research this on my own as well and reference some articles to my neurologist. My neuro then said, "Wow, we've never even heard or seen anything like this before. But the articles you show me are written by respectable experts in the area and published in very good journals, so let's try to treat it." Now I'm being treated for RIH with Diamox, which seems to be slowly working. So I had to basically self-diagnose twice. It's honestly not fun. It's exhausting and stressful. But you have to do what you have to do. I've made sure to read highly cited research and then bring this forward to my doctors and hear what they have to say. Story 22. I'm not a doctor or a nurse. I am a CNA, though. My son had croup, and with having asthma, he was having a harder breathing time. So I took him into the ER mid-morning. I told the doctor he has croup because of all his symptoms. Also, it's not his first time having it. The doctor told me it was impossible because it was daytime, and croup doesn't appear around daytime. It must be something else. So we ran all the tests even though I knew it was a bad case of croup. Well, my son finally coughed, and it's that seal bark cough. He looks at me and is like, "Oh, it is croup. Told you it was." He now knows that croup happens during the day now. Shaking my head. Story 23, I've told this story before. I had a 65-year-old female patient with a history of well-controlled hypertension and diabetes, otherwise healthy. She woke up in the morning and told her daughter that she would die that day. She had breakfast. She demanded that the daughter take her to a lawyer to make a living will in order to make sure she would be DNR when she died. The daughter humored her. Then she had lunch at a restaurant. At 4 p.m., she collapsed. She came to the ER where I saw her. The daughter presented the living will to me. She died at 5 p.m. comfortably. Story 24, not the doctor, but the patient. This was around fall 2019. I was working in the kitchen of my local bar, getting close to closing time, so I was putting things away and cleaning. I'm not entirely sure what caused it. Maybe moving something in a weird angle or the chemicals used to clean the flat grill. But my chest was hurting me whenever I moved. I worked like this for 2 hours, and it kept getting worse to the point that my body was contorting to compensate. After my shift, I sat down at the bar and had a beer chatting with the head cook. I told him I think my lung has collapsed. Now I'm fairly skinny, 6'3", and was 28 years old, but I looked like I just left high school. He thought I was being dramatic. So I go home and have my roommate take me to the hospital because it's just getting worse. When I arrive, I tell the front desk I'm having chest pain and I think my lung has collapsed. Doctor doesn't believe me. I told him I vaped and he assumed it was all due to vaping. Well, get an MRI and I have an 80% collapsed lung. Watch them cut my chest open with a scalpel and ram a tube into my chest cavity. They said it was due to my body's fluid spontaneous pneumothorax due to being tall and skinny. Was in there for 4 days and the nurses kept bringing up that I diagnosed myself. Luckily, no long-term effects other than I can never go scuba diving now. Story 25, I had been battling stomach pain for years and it fluctuated between dull and sharp 10-10 pain every couple weeks, or if I ate something new or exotic. Also felt tearing in my abdomen and experienced bloating like crazy. Told doctors I thought I had Crohn's disease, and they thought I had a hernia. Lo and behold, moved cities and got a new doctor. Doc schedules a colonoscopy and got diagnosed with Crohn's right when it was finished. Story 26, far less dramatic than some other people. But I grew up in a fairly medical household. I'm not a medical person myself, but I have enough knowledge to know when to see a doctor. When I was in my early 20s, I took someone to the emergency room one night because they had a badly infected wound. When I told the middle-aged doctor that it was an infection, he chuckled and said, "Don't be silly. I'm sure you just mean that it's inflamed." I told him, "Yes, it's inflamed, but it's also infected." He rolled his eyes at me like, "Sure thing, little girl." The nurses and other doctors chuckled. The doctor then looked at the wound and said, "Oh crap, it's really badly infected." He wouldn't make eye contact with me after that. I guess it's not quite the same thing, but it just annoyed me that instead of just saying, "Cool, let's see this thing," he had to argue with me and try to make me feel stupid in front of his colleagues. When something is slightly green and bright red lines are spreading out from the wound, it's infected. Even a non-medical person can tell you that. This isn't rocket science. Story 27, I wasn't going to post since I'm the patient, not the doctor, but I have a complicated medical history and all of it I've had to research myself. I have a genetic connective tissue disorder, hypermobile Ehlers-Danlos syndrome. So joint pain my whole life, which I assumed everyone had to deal with since I was always brushed off. Orthostatic hypotension, so I constantly hear, "With that blood pressure, you'll live forever." And I think Shrosh reply, "It'd be nice if I could stand up for more than a few minutes at a time though." I thought I was a hypochondriac most of my life, until I caught myself and said out loud, "Right, I shouldn't kneel like that. I might dislocate my knee again." In front of someone who had EDS and they asked if I had it. Eventually I researched and then pushed for a diagnosis. Ended up having to go out of state to a specialist because no one here was willing to say I had it. Even though the evidence was there, they would treat me like I did but weren't comfortable writing it down. I'm almost 35 and my quality of life is that of a geriatric. If it had been caught sooner, if insurance would cover continuous physical therapy for people like me, maybe I wouldn't be where I am. I also want to go back and forth through my laundry list of doctors who brush me off and tell them to pay attention. Story 28. I like to point out that yes, many times I felt weird and not right, and once I see a doctor, they almost automatically think you're self-diagnosing, or it's all in your head. If you are a doctor reading this, and these many other accounts, please don't just dismiss someone and make them feel like their pain or worry is something to be taken lightly, especially when it comes to mental health. Stop 21 questioning people. They come in with an issue. You should do your best to resolve that issue. Dismissing patients is clear evidence that you don't take your job seriously or the health of your patients. Story 29. Not a doctor, but almost 30 years ago I was pregnant. I knew something wasn't quite right because I was experiencing intermittent spotting that was getting more frequent. I called the OB/GYN's office a couple times trying to get in to see him earlier than the initial appointment I'd set up at the 12-week mark. Both times his staff just told me that spotting was normal this early, nothing to worry about. No, the doctor didn't need to see you early, blah, blah, blah. Heading it off to an over-anxious first-time mother. Found out later from a friend in med school that if I'd mentioned that the blood was dark red, which it was, but I didn't know this was relevant at the time, it would have thrown up some major red flags for the staff. Lesson learned. So 2 weeks drag on with me, knowing something is wrong, but the staff isn't listening. My boyfriend's telling me I'm overreacting, even though sex is becoming painful. I didn't have insurance and this was pre-internet, so I was literally stuck in panicking. I was able to do enough research to suspect it was an ectopic pregnancy, which meant there was no way to save the fetus, and accepted that the fetus was probably already dead and was just trying to figure out how to avoid dying. Ruptured ectopic pregnancies can cause you to die from internal bleeding, FYI. Long story short, one day, I get hit with the worst cramps I've ever experienced. I'm pale and sweating profusely. Drive myself to the doctor's office, practically crawled into his office. Within 15 minutes, I'm in the ER. Few hours after that, I'm in emergency surgery because of surprise, surprise, a ruptured ectopic pregnancy. Story 30, I went to the doctor 6 months ago with a small lump inside my belly button. Booked straight in with a surgeon instead of the GP because I knew it was a small umbilical hernia. I told him that, and he sent me off for an ultrasound. Came back as indeed an umbilical hernia around 1 centimeter. Booked surgery for 3 days later and got it fixed up. He couldn't believe I'd correctly diagnosed it. Story 31. Not a doctor, but a pretty wild story. About 7 years ago, I began to notice a super erratic but incredibly severe shooting pain in my left foot. What began as random twinges progressed over the next 4 years into an almost constant cattle prod-like pain. Initially, I saw a podiatrist who said everything was normal, aside from some synovial swelling and inflammation. I was told to take Advil regularly. Over the next couple years, I saw a neurologist, general physicians, general therapists, pain management doctors, very expensive, and multiple rheumatologists. In about the third year of dealing with this, I developed a stress fracture on my opposite hip, which put me in crutches for a month. The sports medicine doctor who treated me couldn't understand how a 26-year-old would develop this type of fracture with normal bone density. I told him it was because I couldn't put weight on the other foot and pointed out a strange lump in the calf above my painful foot. He told me it was a muscle knot, as did every other medical professional I spoke to. Keep in mind I live in NYC, so these were top-of-the-field medical professionals. I had a hunch that it was a tumor, but would get laughs and eye rolls from doctors and friends whenever I would suggest it. When one doctor recommended psychiatric help for my hypochondria, I essentially gave up and figured I would have to live with the pain. I never felt so crazy or hysterical as I did being constantly ridiculed, judged by the doctors I was trying to communicate my concerns to. I went from being a daily runner to not being able to walk without a limp and losing a ton of function in my leg. At one point, it had been about 4 years, and the pain was unreal. I have a huge pain tolerance, but I would sob silently at my desk during work hours, and sleeping at all during the night was a thing of the past. It was pain I wouldn't wish on my worst enemy, like a mix of burning, shooting, stabbing electric jolts that literally made me cry out. And toward the end, it was happening at 2 to 5 minute intervals all day, all night. When doctors weren't able to find a cause for it, my final rheumatologist decided that I should be put on immunosuppressant therapy. I have psoriasis, so psoriatic arthritis was their best guess. I finally put my foot down and threw a tiny tantrum in the doctor's office after pointing out again the growing lump on my calf and being told again that it was just a muscle knot. I demanded to have it imaged before moving forward with treatment. I'd Googled symptoms and was firmly convinced it was schwannoma, or similar nerve sheath tumor. 15 minutes later, the ultrasound tech confirmed that's exactly what it was. Her exact words were, "Damn girl, you were exactly right. Good for you for advocating for yourself." The relief of having a cause for years of pain is tough to describe. I eventually had the tumor imaged and evaluated, and after a scare that it may have malignant qualities, had it removed by a top surgeon at Johns Hopkins. As it turns out, it was an extremely rare hybrid of 3 different nerve sheath tumors and had grown within my tibial nerve. 3 inches of nerve graft later and 0 pain. Almost full feeling back in the foot and nearly perfect mobility. I will never forget how stupid doctors made me feel as a female, and how quick they were to dismiss my pain as a symptom of psychological hysteria. I don't think that would have been the case if I had been a man complaining of severe pain. Morale of this long story: be your own advocate. We aren't all doctors, but we know our bodies. Story 32, I had a massive vertigo spell back in 2016. My world spun for months. Aside from it being a female dog to try and see the ENT specialist and brain specialist, the overall diagnosis was a migraine aura without headache. After the medication they put me on, gave me a reaction. They didn't try anything else and basically said, suck it up, despite the fact that I insisted that it had to be something else because all this vestibular therapy they'd assigned to me wasn't working. Moved to Tennessee, start having more episodes, go to Vanderbilt. Turns out I have BPV, and it's fairly uncommon to see a young person with it. 25-year-old female. It's an everyday struggle, but let me tell you how vindicating it was to know I was right. Story 33. I remember I was suffering from low hemoglobin count and bordering on anemic. It started shortly after I began taking new meds. I asked my doctor if it was the reason why, and she said no. It was probably because I was donating blood regularly. I was confused as to why it didn't develop before, since I'd been donating since I was 18 and was almost 40. I kept bringing it up, and she insisted the drugs were not the culprit. I finally asked about side effects of each drug. She said one of the drugs can cause a certain change in my blood, which then causes low iron, which then causes, low hemoglobin. Story 34. I was the patient here. I discovered that phimosis ran in my family and I had it. When I was born, the doctors refused to circumcise me because I wasn't Jewish. The first specialist I spoke to told me I didn't have it and I was just being ridiculous. Despite explaining that I cannot have sex due to this issue, he made me leave his office. I then got a referral to a different specialist in another city where I was told my concerns were correct and I was permitted surgical intervention. Downside was I ended up with nerve problems post-surgery and cannot feel F-all most of the time down there. But hey, I was right. Story 35. I was a student athletic trainer in high school and college, so I know some stuff. Anyway, I sprained my ankle in 2000. 10 years later, my ankle began swelling and aching all the time. I went to my regular PCP and he sent me for x-rays and an MRI. Meanwhile, I'm thinking about it and what I saw. When I went back to the doctor for the results, I asked if it was osteochondritis dissecans, when a bone dies and causes the cartilage around it to die due to lack of blood supply. My doctor gave me a PO'd look. You'd think he'd be used to me by then, LOL, and said I'd have to discuss it with the orthopedic surgeon. Because I was right. Story 36. Not a doctor, but my wife was diagnosing that the excruciating pain that shot through my leg was not tendinitis, but some form of back issue. 2 doctors completely misdiagnosed it and took my wife dragging me to a third sports medicine doctor to figure it out. Crazy part was he diagnosed it in 5 minutes with a simple leg lift test that apparently the other doctors were too lazy to perform. Like seriously, if all the signs don't point to tendinitis, don't randomly agree with the other random doctor because you can't figure crap out in 30 seconds. Second doctor literally prescribed bed rest, which was the worst thing I could do for my body. Like if tendinitis isn't painful to the touch, it probably isn't tendinitis. I spent a month in bed barely moving when I really needed physical therapy. I also knew that doctors hate people Googling symptoms, but maybe if medical error wasn't a leading cause of death in the United States, and it seemed like doctors actually listened to patients, we would be in a better position with our society's health. Story 37. I went to my OB-GYN to tell her I was pregnant with multiples. I was only 3.5 weeks pregnant, but my history of tubal pregnancy requires early action to ensure it doesn't happen again. He tells me to just relax and we'll find out. I keep telling her that HCG numbers are too high. She gets the ultrasound up and blurts out clear as day, "Oh, there's 2. Don't judge her language. We had been through so much and had an amazing bond. It took years to get my first child. She was amazing but moved away. I'll never forget her." Story 38. The obligatory not a doctor, but the patient. I've known since I was in high school and I had polycystic ovarian syndrome. I started having cycles when I was 11 that hadn't regulated by the time I was 16. Incredibly easy to gain, hard to lose weight. An abundance of facial and body hair, terrible mood swings and depression, along with a few other symptoms. Whenever I brought it up to doctors, it was always dismissed like nothing was wrong. Finally, I went an entire year without a period, found a new doctor. Since it's COVID times, the first meeting we had was a phone meeting. I told her straight up it's either PCOS or premature menopause. I started having hot flashes along with migraines and light and sound sensitivities. She didn't question me. First doc to ever tell me it sounds like I'm right, and immediately ordered all my testing and such. Lo and behold, I have PCOS. Had it from day one. Pre-diabetic due to it, but have enough time to get back to the safe zone. Getting treatment for cancer prevention since I'm at a higher risk for certain ones thanks to hormones. Story 39. Not a doctor, but I had a self-diagnosis that was right my sophomore year of high school. And I woke up that morning and my stomach felt off, and I knew I wasn't constipated. That whole day I kept telling my teachers, and they all said I was fine, and just a stomach bug. After school, I had a track meet and told the trainer I thought it was my appendix, and he told me, "Stop being a P word. You're just constipated." 3 hours later, I'm at the ER getting prepped for surgery because I had appendicitis, and they said I caught it so early that it would have been hard for anyone to know without a scan. Story 40, I was 17 in healthy shape and in high school. I was pretty skinny but had terrible periods. One day I felt this sort of ball in my hoo-ha when I would sit down. Googled it and ended up finding the word prolapsed uterus. I went straight to the emergency room where they treated my sister's leukemia and told the ER doctor what I thought. He immediately got a weird look in his face and said that would be impossible since I was too young, but that if I was right, he would let me complain to his boss. The doctor used a speculum to try and find the pain, and in doing so actually ended up pushing my slightly prolapsed uterus back in. Lady boss came in the room to tell me there would have to be testing done to find out how this even happened, and I got to complain and say I was smarter than the ER dude. 2 years later, I haven't had any problems, but I did end up finding out I have a genetic condition that causes problems with my collagen and somehow makes me more hyperflexible. Cool, I guess. Story 41 NNAD. I'm the patient. I went to see my doctor because I had all the symptoms of being pregnant, including a missed period, but multiple tests had come back negative. I'd already had one of my kids, so I had a good handle on how my body feels when I'm pregnant, even aside from the missed period bit. I told him that something was wrong with my body, but I just wasn't sure what. They gave me another pregnancy test, and when it came back negative as well, they said I was probably just late, and I'd be fine. I called and called and called, trying to convince PAs and nurses at the practice to listen to me. Finally, they got so fed up with one of them, they agreed to schedule an ultrasound. I remember the ultrasound tech who had been talking and joking with me suddenly fall silent and start focusing on her screen. The PA who agreed to the ultrasound later called me and said I had 3 or 4 ovarian cysts that would likely clear up on their own. Usually true. Ovarian cysts aren't often a big deal. Well, I'm signed up for electronic charts and my ultrasound results were sent to me later that afternoon. What they actually said was that I had 3 or 4 cysts on one ovary and an uncountable number on the other. I was so mad. I literally just wanted to know why my body felt the way it did, and I was repeatedly told it was nothing. And then even when they found the reason, it was downplayed. I switched doctors and have a new one who's amazing. She thinks I have endometriosis, which would explain both the cysts and the absolutely horrifying pain I've had with my periods for 10 years, which other doctors have always told me to just take more ibuprofen for. Story 42. One day when I was 27, I thought I felt a lump in my neck. Of course, I assumed it was cancer. I went to the doctor who said, "It's nothing. You're too young for cancer and your blood tests are fine. But go see an endocrinologist if you're worried." I went to an endocrinologist who said, "It's nothing. You're too young for cancer and your blood tests are fine. But let's go do an ultrasound if you're worried." The ultrasound showed a lump, but the radiologist said, "It's probably a benign goiter. You're too young for cancer and your blood tests are fine. But let's do a biopsy if you're worried." The biopsy came back, "Maybe, I'm not kidding." They said it could be cancer, it might not be. So the endocrinologist said, "Go to a surgeon." I went to a surgeon who said, "Sure, I'll take it out, but only the side with the lump. If it's not cancer, you don't want me to take out the whole thing, do you?" Kind of, yes, I do. And I will do a frozen section and find out right away if it's cancer. And if it is, we'll take the rest out okay. They took out just the side with the lump. Frozen section was inconclusive, so they closed me up. Sent it to a pathology in the hospital and to 2 other path labs. 2 weeks later, "Hi, looks like it was cancer after all. How soon can you come in to get the rest taken out?" Story 43. Not a doctor, but an older brother who called it, and parents didn't listen. Sister had some weird thing with her nails. I don't remember much else from that time, because it was years ago. When I searched it up online, I found something called hand, foot, and mouth disease. And I was like, hey, it might be this. My parents were like, nah, you're wrong. Eventually, they did take her to the doctor, who confirmed she had it. Story 44, I had a kidney infection. I told the doctor I had a kidney infection. He asked me some symptoms questions, and I responded honestly. And I guess I didn't check off his boxes. He told me I didn't have it, and I said, okay, can you put in my file that I said I had such and such symptoms and thought it was a kidney infection and that you declined to test? He got really salty, rude even, but he ordered the test. He called personally when the results came and apologized. He was a young guy recently out of med school. I told him, you'll have to learn to trust people. People who are lying because they Googled something will say yes to every symptom. If someone has had a problem before, pay attention if they say they have that same problem again. Story 45, not a doctor, but last year I had a fever that wouldn't go away. And after 3 days, I went to the doctors, and the guy was like, well, I checked your lungs with a stethoscope, and it's not pneumonia. And I had no cough, so it's probably viral, etc. Well, after 3 more days, the fever was still there, and I went to the doctors again. This doctor also checked my lungs and said it wasn't pneumonia. I knew it was so. I called back the next day and demanded a chest x-ray, and they were like, okay, fine. So I went in, and they took the x-ray, and they said they'd get back to me with the results the next day. They called me back not even 15 minutes later while I was still driving home from the doctors. It was pneumonia. I wouldn't have confirmed diagnosis without my insistence on the chest x-ray, and now I don't trust any male doctors for not taking me seriously. Story 46. A girl I used to know kept going to her doctors, complaining of pain, and begging them to do a scan in case it was serious like cancer or something. Doctors kept putting it down to IBS because she was too young. She collapsed, so they finally sent her to hospital to get looked over, and sure enough, it was bowel cancer. I think it was about 2 weeks later she passed because they caught it far too late. Her parents started trying to raise awareness of her situation and thinking how many young people are misdiagnosed because they're too young for it to be anything serious. Story 47, obligatory, not a doctor, and obligatory, not my story. About 14 years ago now, I had a chest cold, and I passed it to my dad. I got better. He did not. His symptoms got worse and worse, and he was having to stop multiple times on his way to and from work to throw up. He was going to our family practitioner, who was only treating the symptoms and sending him to specialists for the symptoms. My dad thought if they did a blood test, it would show up what was wrong with him. He begged for months for a blood test, and the GP kept laughing at him and asking what he expected to find. My dad wasn't sure, but he said he knew a blood test would come back with the results. GP never ordered the test and kept treating just the symptoms. After round of antibiotics, my dad started having diarrhea. Constant liquidy diarrhea. GP sent him to a gastroenterologist to, you guessed it, treat the symptom. Gastroenterologist thought it was odd that a 44-year-old man had vomited his way through losing over 40 pounds in less than 6 months and had an intestinal issue almost exclusive to elderly people. An infection called C. diff, which was causing the diarrhea. He was ordered a blood test. Finally, effing leukemia. His blood draw was gray from all the half-formed white blood cells in his sample. Dad stopped seeing the GP immediately. He got hooked up with a really great oncologist and is doing great now. Although he does have to take a chemo pill every day and get blood draws and bone marrow biopsies every so often to make sure it's maintained. Fun story though, we didn't have time after that to find a new GP for my physical for my driver's permit. So my mom reluctantly took me to the same GP for the physical. We got to the personal question part of the exam where he asked about my sexual health, and he told me that based on my build, I had huge breasts and very wide hips for a 16-year-old. I had to be sexually active, and he yelled at me for lying to him when I told him I wasn't and hadn't even had my first kiss yet. He was so frustrated with me that he stormed out of the exam room and didn't come back. I sat there for 20 minutes before I realized that, though. And when I finally gathered up my things and went to the waiting room to meet my mom, he asked me if something was wrong. I thought I'd get in trouble, so I said no. I think if I told her what happened, she would have possibly assaulted him for letting her husband's leukemia go untreated because he was too stubborn to order a blood test, and he was implying her daughter was lying about being sexually active in order to bully her into a pelvic exam. Story 48. Not a doctor, but I do work in a hospital. And just the other day, someone I know came to the ER with a history of intense migraines who insisted he had a brain aneurysm after Googling his symptoms. Docs brushed him off at first because he's in his late 20s, but they went ahead and ordered a CT, and he was quickly shipped off for emergency surgery because he did in fact have a brain aneurysm. Story 49, I went to the ER with a prug mammary duct mastitis. I was very sick, feverish, vomiting headache. I was told the mastitis couldn't make you that sick. So they did a lumbar drip-sampled spinal fluid, and I spent 3 days in the hospital because they thought I had meningitis. Turns out I had mastitis. Story 50. I'm not a doctor, but I was able to figure out my daughter's rare genetic disorder that many doctors have never heard of. My daughter was found to have severe facial brain and heart defects when I was 25 weeks pregnant. The sonographer, genetic counselors, and maternal fetal medicine doctor all had no idea what they were looking at. The karyotype microarray and test for some of the more common single-gene disorders came back normal. We were told it was some sort of genetic disorder, but some are unable to diagnose because finding a single-gene mutation is kind of like finding a needle in a haystack. We decided to end the pregnancy, and we were able to view my daughter afterwards. I won't go into too much detail, but her facial features were very severe and unique. I had to know what that did to her and if it was something that could happen again. After a while of searching through various scientific articles, using all the terms I'd picked up during our weeks of genetic counseling, I found something that fit her perfectly. Acromelic frontonasal dysostosis, caused by the gene ZSWM6. I sent the articles and pictures of my daughter to our genetic counselor, and we used a leftover sample from the aminosynthesis to test for the gene. Sure enough, it came back showing a mutation in ZSWM6. As of 2019, there were 22 known cases of her disorder in the world. Story 51. This is a case where I was the patient and my mom was right about everything. I was 12 and started having really bad pain in my left side. I started puberty really early, as my mom was sure it was hormonal, so it was my aunt who's a doctor. She took me to the ER where the doctor said it was just cramps and sent us home. The next day I collapsed and was taken back to the hospital. It was a massive ovarian cyst. It burst and I almost lost an ovary. There were several more that I had massive surgeries for. Story 52. So disclaimer, I was the patient. I woke up for a bathroom break and saw this focaccia bread-looking blob on my knee, which was effing weird. I went back to bed, and when I woke up a few hours later, it had started to blister. I did some Googling, and the closest thing I could find was a hobo spider bite, similar to the brown recluse that causes necrosis. Pretty much the only solution is to take antibiotics and don't touch it or pop it. Do or don't Google it. The pictures are nasty. I went to my doctor that afternoon, and she refused to believe me. I think she disliked me because I had been honest about smoking weed, which was illegal at the time. She kept asking if I had gotten drunk and fallen or burned myself, and I kept insisting that it was a spider bite, and I needed to go on antibiotics ASAP. She also knew that I'm not a fan of antibiotics, only take them when I absolutely have to, but still gave resistance to supplying them. Finally, she relented. I never went back to her and found a much better doctor who did fantastic follow-ups during the next 2 months of having a pus-filled hole in my leg. 10 years later, I still roll my eyes at the first doctor when I look at the gnarly scar on my knee. Story 53, went in and told my doctor my gallbladder was bad when I was in the middle of an attack. Had an ultrasound later that morning. Checked into the hospital that night. Gallbladder removed 3 days later. Pro tip, don't wait until you get a stone stuck to go to the doctor. What could have been a simple outpatient surgery was a 4-day inpatient surgery with tons of antibiotics, clear diet, and a much larger bill. Story 54. When I was pregnant with my third baby, both of my sons got chickenpox. I panicked and told our pediatrician that I never had it. Exposed many times but never got sick. He was adamant that I was wrong. I didn't get it then either. Skip ahead 4 years. I now have 4 sons and they all started getting sick, looking like chickenpox. Same pediatrician says the oldest 2 are no way CP for a second time. Took them all in and I was feverish and itchy. When the doctor saw us all, he just stood there, mouth agape. My 2 boys each had CP again. I finally caught it at 30 years old and 13 exposures. Nothing is impossible. Story 55. Not a doctor, but when I was about 25, I noticed that I was having really bad pain in one of my legs, followed by shortness of breath. I couldn't make it up a single flight of stairs without feeling absolutely winded. I knew immediately that I had a blood clot because my father had gone through the same thing years earlier. I went to the doc and explained what was going on and that I was pretty certain I had a blood clot. The doctor was incredibly dismissive and told me, "There's no way, you're too young. But if it'll make you feel better, I'll order a blood test." She ordered the D-dimer test and then called me apologizing the next day because it came back with a positive result. She told me to immediately go to an imaging center for a CT scan. And from there, I was sent immediately to the hospital with a DVT and PE in both of my lungs. Good times. Story 56. Not a doctor, but I told 6 GPs I thought I was lupus before I finally got referred to a rheumatologist who told me it's lupus. The first symptom I noticed was a malar rash, a rash across the bridge of my nose and on both cheeks. At first I thought it could be sunburn, but it was slightly raised and was persistent. Nothing I did made it go away, and I noticed I was slightly worse after sun exposure. It was photosensitive. Naturally, I Googled it. Google told me it could be a malar rash, which is typical of SLE, a form of lupus, or it could be rosacea, a skin condition. I'd also been very fatigued, had bad joint pain, had consistently weird blood results over a few years, which showed inflammation with no known cause, and my hair was doing weird crap, growing little hairs at my crown like a baby. So I'd go to GP and I say, "Hey, I think something's up." He tells me it's probably anxiety and contact dermatitis. I ask if maybe we should get a blood test to see if there's any autoimmune indicators or whether I should go to a dermatologist, and he's like, "Nah." So I go to another one, essentially the same answer. Eventually, I find a doctor who agrees that the likely differential is autoimmune or rosacea and sends me to get tested, and it's lupus. My ANA is positive. My SSB is positive. The roomie looks at my hair and nails and basically says, "Yeah, dude, lupus." While I understand why Dr. Google must be deeply irritating to docs, sometimes your patients are well educated. I have 2 degrees and are capable of reading info and being critical about it. It doesn't mean you should give a crap per se, but if an intelligent person is saying, "This isn't right, I know my body, can we investigate?" maybe pay that some due. Lupus can be notoriously difficult to diagnose. The average diagnosis time is literally 6 years. I'm glad I put the pieces together and advocated for myself. Story 57, resident physician here. As stated previously in this thread, a lot of patients will tell you they feel like they're about to die. We call it a feeling of impending doom in medicine. It's always ominous because not infrequently people call it pretty correctly. I've had several patients in the ICU tell me, "Doc, I'm not making it out of this hospital," and then hours later get called to the bedside to code them. Most die. There's something about a lucid patient being confronted with their mortality in a very acute way, as opposed to someone with a terminal disease that is very haunting and sticks in your memory forever. Story 58, I was posted about this on another Ask, an obligatory not a doctor. A few years ago, I had a 103 fever, and my intestines were bleeding out. Since my blood test showed my white blood cells were fine, my doctor told me it was all in my head. Every week I came back saying my symptoms were still there, and he'd just do another blood test. Also, by the 3rd week of this, I started passing out every time they drew the blood, which had never happened before in my life, and this also didn't concern them. I was convinced I was going insane since I already have a mental illness. Then one of my college professors, who used to be in the medical research field, asked me why I was missing class so much, and I told them why. They told me to ask for a colonoscopy. I went and asked for one, and his response was, "No, you're only 19. You don't want a camera put up there." Not because he thought the bleeding was a lie, but because no one that young should have to go through the experience of a colonoscopy. Luckily, I have IBS and already knew a gastroenterologist, so I just went straight to him and asked for it. He was surprised I had the bleeding for so long, and it had gotten to the point where I was becoming anemic, which, by the way, my doctor also didn't notice after all those dang blood tests. I did the colonoscopy a week later and found out I had salmonella poisoning. So if my teacher hadn't mentioned I should get a colonoscopy, and if I didn't already know a gastroenterologist, I would have spent the rest of my life thinking I was going insane. 0 out of 10 experience. Would not recommend. Story 59. A girl came in saying she had syphilis because she had lumps in her tongue, and she gave oral to some dude she didn't trust. The thing is, she thought her papillae, normal anatomic feature of the tongue, were syphilitic lesions. We had a laugh about it, but I still requested an STI panel, and guess what? She had syphilis. Edit. Oh, and I felt super ashamed of it, even though she didn't have any comparable scars. And I told her I was sorry for rushing to say it was likely nothing. But she was very grateful to me and wanted me to be her doctor because she said I was the only one who cared enough to still ask for an STI screening. She had seen other doctors who dismissed her quickly. Story 60, got stung by something. Never saw it while working as a farmhand. Felt a little funny and finally collapsed later and slept 16 hours. Woke up, threw up, and went back to work. About 10 a.m., I finally told the guy I was helping that I need to go to the hospital as my throat was a damn near closed and I felt like I was high. Drove myself to the nearest hospital, about 30-minute drive, almost fainting. Got to the hospital and passed out in the parking lot in my car. It was July 4th and about 90 degrees. Luckily, I didn't die. Stumbled into the hospital and to the front desk and just muttered, "I think something's wrong." The front desk calls the town doctor, and I remember him being kind of pissed as it was July 4th. And he walks in, I say, "I think I'm allergic to bees." He puts on his glasses and glances in my throat, and the shock in his eyes says it all. Gave me some medicine and sent me on my way. I slept another 2 days and lost 16 pounds. Story 61. Back in middle school, I tore my ACL and meniscus playing basketball, and it took 3 doctors to diagnose it as such. I told my parents that I knew something was wrong with my knee and should get it checked out. We went to a Med Express and they said it was probably just a sprained knee. After a few days of it not getting any better, I looked up, why is my knee buckling? And every result came back as a torn ACL. I proceeded to another doctor and described exactly that my knee kept painfully buckling. I clearly had a lot of effusion around my knee and was limping. This doctor got me an X-ray and said there was nothing there. It's probably a bone bruise or a hamstring pull. We went to another doctor who finally ordered an MRI, and lo and behold, my ACL was completely gone, and so was my lateral meniscus. 8 weeks of limping around, and I finally got a date for surgery. About a year later, I tore my meniscus again and told the doctors before they looked at it, I tore my meniscus. I knew the feeling since it happened before. That time, they quickly ordered an MRI and diagnosed it as a torn meniscus and quickly got it trimmed. Still amazes me to this day that it took 3 different doctors to diagnose a torn ACL, and a 14-year-old middle schooler knew what was going on before they did a quick Google search. Story 62, I fell over back in December 2015. Literally just tripped and fell on my arm. Had it x-rayed. Fine. No problems at all. Still painful and weak 2 months later, so I got an MRI. Said they'd get back to us if something was wrong. They didn't, so we assumed it was fine. Still weak and sore 3 years later with no word back from the MRI people. But I took myself at 14 years old to A&E to get it checked. I told them it felt broken still. I have soft bones that break easily. They said it couldn't be broken because I wasn't in enough pain for that. Same condition that affects my bone density also makes me rather immune to pain. I saw a specialist doctor for my scoliosis 4 years after the fall and asked him to take a quick look at the MRI. He found a hairline fracture in the scaphoid bone and sent me for another MRI and actually got back to me on it. My scaphoid had broken in 2 and grown apart. 1 bone graft surgery failed, and a titanium screw later. I still have a broken wrist, I'm still in pain, and am still never believed when it comes to medical issues. Could have been fixed with a simple Velcro brace back in 2015 or 16. 5-year anniversary is coming up. Whoop story 63. 2 patient stories. Me. For 6 years, I would get an extreme pain in my calf if I knelt down and stood back up, like a severe cramp. Started when I was 13, went to the doctor multiple times over the years to be told I was young and probably just tore a muscle fooling around. It wasn't until I was at uni that it was so bad I couldn't extend my heel to touch the floor without severe pain. My boyfriend insisted I go to the doctor and did not leave until I got answers. The short of it, AVM, arterial venous malformation. I had 2 sections of my calf repaired. I could walk the day after surgery. My husband went and climbed Kilimanjaro, followed by safari in Tanzania. About 2 weeks after returning, he complained of ongoing chronic headaches and not being able to drink enough water. Went to the doc and said, "We think he has malaria." Doctor took blood, and that was it. Wouldn't return calls as he got worse. After 4 days in ICU, finally get a call from the original doctor that he did indeed have malaria.